Girl, you know it's messy. Politics and our health. It's like trying to mix oil and water. They just don't blend smoothly. Let's be real, y'all. Politics and healthcare, they go together like fish and grits. You can't have one without the other, and yet they always seem to be at odds. One minute, they talking about affordable care. The next minute, folks losing their jobs at the very agencies supposed to be keeping us healthy. It's a roller coaster ride, and not the fun kind. It's enough to make you want to reach for the sweet potato pie and call it a day. Comfort food becomes our go-to when the stress of it all gets too much. But we ain't got time for that. We need to stay focused and proactive. We got to talk about what's happening over at the Department of Health and Human Services. It's crucial to understand the impact of their decisions on our daily lives. See, HHS is like the big mama of health in this country. They hold the reins to so many aspects of our healthcare system. They oversee everything from the CDC, the folks tracking all those new viruses, to making sure we are prepared for any health crisis that comes our way, to the NIH, the ones funding all that important medical research, ensuring that we continue to make advancements in medicine and healthcare, to the FDA, the ones making sure our food and drugs are safe. They play a critical role in our everyday lives, often without us even realizing it. But lately, HHS been looking like a bad relationship. All drama, no stability. It's like watching a soap opera unfold, but with real-life consequences. And honey, when the drama spills over into our healthcare, we got a problem. It's not just about politics anymore. It's about our well-being, our families, and our future. We need to stay informed and engaged because our health depends on it. Now, I ain't no politician, but even I know you can't just go around firing folks from essential health agencies and expect things to be peachy keen. But that's exactly what's happening. The CDC, the NIH, the FDA, they all been hit with these mass layoffs. Scientists, doctors, researchers, support staff, good people who dedicated their lives to keeping us healthy, shown the door like yesterday's leftovers. And for what? Budget cuts, restructuring? Baby, please. It's just plain old political maneuvering if you ask me. We talking thousands of jobs lost, y'all. Thousands. These ain't just numbers on a spreadsheet. These are real people with families, mortgages, and dreams. And the impact on our public health, don't even get me started. Fewer folks to track disease outbreaks, research life-saving cures, and ensure the safety of our food and medicine. It's like playing Russian roulette with our health, and honey, I don't gamble. Now, I ain't one to point fingers. Okay, maybe I am. But we got to talk about the elephants in the room, Trump and Musk. These two powerhouses have been making waves, and not necessarily the good kind. They've been whispering in the government's ear, pushing their own agendas, and these layoffs? They're not just random acts of corporate downsizing. They reek of their influence. It's like a puppet show, and guess who's pulling the strings? Yep, you guessed it, Trump and Musk. Trump, with his disdain for anything resembling government regulation, has been on a mission to dismantle the very fabric of oversight. And Musk, with his Silicon Valley dreams of privatizing everything but the air we breathe, is right there with him, pushing for a world where the rich get richer. They see HHS as ripe for the picking. They're eyeing it like a hawk eyes its prey, ready to swoop in and take what they want. They're talking about cutting costs. But let's be real here. What they really mean is cutting services, cutting oversight, and leaving the most vulnerable out in the cold. And while they're at it, they're lining their own pockets in the process. It's a classic tale of the rich getting richer, while the rest of us are left to pick up the pieces. From vaccines to virus detectives, public health programs are the backbone of our community's well-being. But now, these essential services are feeling the pinch due to significant budget cuts and funding issues. So, what does this mean for everyday folks like you and me? It means that the safety nets we depend on are fraying. It means the public health programs we rely on, the ones that keep our kids vaccinated, our food safe, and our communities healthy, are at risk. These programs are not just services. They are lifelines. They ensure that our children grow up healthy, that our food supply is free from contamination, and that our communities can thrive. But now, many of these programs are on the chopping block. We're talking about cuts to HIV and AIDS prevention programs, maternal health care initiatives, and more. Even critical research into diseases like cancer and Alzheimer's is facing the axe. Officials claim these cuts are about efficiency and streamlining services. But honey, I call it penny wise and pound foolish. Cutting corners in public health is a dangerous game because neglecting public health today means paying the price tomorrow, and that price is always higher. The consequences of these cuts will be felt far and wide, leading to higher healthcare costs and suffering in our communities. It's time to advocate for our public health programs and ensure they receive the funding they need to keep us all safe and healthy. Doctors and nurses, speak out. This ain't right, and it ain't just us regular folks who are worried. Doctors, nurses, public health experts, they all raising the alarm bells. They see firsthand the devastating consequences of these layoffs. They see the overworked staff, the delayed research, the increased risks to public health. They speaking out, writing letters, organizing protests. But is anybody listening? Laid off and left out. Real people, real stories of struggle. Behind all the statistics and political jargon, there are real people whose lives have been turned upside down by these layoffs. I'm talking about Sarah, a single mother and research scientist at the NIH, who's now struggling to make ends meet after being laid off. And John, a CDC epidemiologist who dedicated his life to tracking infectious diseases, now forced into early retirement. Their stories and countless others like them are a stark reminder that these layoffs are not just about numbers, but about real people and real lives. A sick system getting sicker. The long-term fallout. Look, I don't need a crystal ball to tell you this ain't ending well. We're talking about a weakened public health infrastructure, a resurgence of preventable diseases, and a healthcare system ill-equipped to handle the fallout. And who's going to suffer the most? The most vulnerable among us, the poor, the elderly, the folks who rely on government programs for their health care. It's a recipe for disaster. And honey, we all know who's going to be left holding the pot. Stay woke, stay loud, stay healthy. So, what can we do? We can't just sit here and let them dismantle our public health system brick by brick. We got to stay informed, make our voices heard, and hold our elected officials accountable. Call your representatives, write letters to the editor, organize in your communities. Let them know that we won't stand for this assault on our health and well-being. Because at the end of the day, our health is not a partisan issue. It's a human issue. And it's time we start acting like it. So, what do you think? fam. Well, folks, we have come to the end of this informative chapter on how the political wheel spins. Again, thank you to my channel subscribers. You make this channel thrive so others can get an everyday Black American housewife's take on our place in the universe. Please, if you are new here or are already part of the fam and you enjoy my commentary, like, comment, share, and subscribe. It helps with the YouTube algorithm to spread my videos, and it's free. Until next chapter, folks, Cynda 369 out.